Description of services, purpose, treatment objective, outcomes, and service modality. The service is Behavioral Health Intervention Services, which is BHIS. The services may be designed to reduce and eliminate the symptoms of behavior resulting from the client's psychological disorder to prevent the client from functioning at his optimal level. Expected outcomes would be the consumer to obtain knowledge and skills to reduce symptoms. The consumer may receive BHIS when they meet the following requirements as determined by a clinician acting within the practitioner's scope of practice allowed under state law. The consumer may be diagnosed with a psychological disorder that impairs the consumer's independent functioning relative to primary aspect of daily living skills, such as personal relationships and living environment. The diagnosis must be supported by available documentation. The need for service. Clinician, the clinician must assess the consumer and develop a treatment plan indicating the consumer's need for BHIS services related to the consumer's mental, emotional, and behavioral disorder. Reevaluate the consumer in 6 months to evaluate the progress, to review and approve the consumer's continued need for BHIS services. The treatment modality is there is individual services that and services are provided between service provider and the client in a confidential setting. Services should be provided according to the unique needs and potentials of the client guided by the treatment plan. Services shall focus on the client's emotions, perceptions, and attitudes. Be designed to alleviate mental health condition. Be designed to assist the person in identifying and modifying, if necessary, beliefs, emotions, perceptions in order to improve overall function. Be directed by cognitive and emotional dynamics that influence behavior. Be provided through a predictable schedule and form of a formal session. Be provided within the least restricted environment. The goals of the individual services that are to help the client gain insight, clarify perceptions, identify feelings, make connections between thoughts, feelings, and events, develop better coping strategies such as problem solving, decision making, social skills, interpersonal skills, stress reduction, and crisis management. Now, family services are services that are provided between the service provider and the client, along with a minimum of one person in the family member, and this is also provided in the confidential setting. The family services shall be focused on the client's emotions, perceptions, and attitude. Be designed to alleviate mental health conditions. Be designed to assist the person in identifying or modifying, if necessary, beliefs, emotions, perceptions in order to improve function and behavior. Be directed at the cognitive and emotional dynamics that influence behavior. Enhance the family's ability to effectively interact with consumers functioning in the home and in the community. Be provided in the presence of the client. Be provided through the predictability schedule of formal sessions. The goal of family services is to improve family function as a family system is impaired because of the presence of a psychological disorder or a mental disorder in one or more of the family members. Interventions focuses on helping families to cope and improve their communications and interpersonal skills. Now, crisis intervention. Crisis intervention consists of unscheduled, intensive intervention towards children and their caregivers for the purpose of restoring adequate child and family functioning. The service reduces the client's acute emotional behavior dysfunction and accompanying physical and social manifestations. The client in the crisis state needs to draw or learn the following skills: problem solving, identifying and discussing feelings, finding meaning in the event, redefining the event, developing a sense of competence, and maintaining relationships. The goal of the crisis service is to assist the client to resolve the immediate problem and gain emotional equilibrium. And we also have group services. Group services are covered with children whose individual needs can be addressed in this context. The service must be able to effectively address the goals and objective on their treatment plan and increase the individual functioning. Group services are designed to provide services in a group of consumers who fall within the same age group and have similar diagnosis or impairments. The goal of the group is to install the hope, universality, imparting information, and corrective recapitulation. The development of those socialization techniques, interpersonal learning, and the opportunity to learn to talk openly about themselves and their situation. Practice active listening and giving and receiving feedback. Learn to help others and learn new ways of relating to others. Now, we also have skills training for adults. Services are to be provided for consumers 18 and older. Skill training and development includes interventions to enhance independent living, social and communication skills, and that minimize and eliminate psychological barriers that consumers' ability to manage symptoms associated with their disorder. Interventions may include the following skills: functioning with family, peers, community. Communication skills, conflict resolution, problem solving, social skills, interpersonal relationships, and employment-related skills. The goal for the client is to reveal feelings that they are able to verbalize and act out in a constructive manner, understand the relationship and interactions with each other and others, and teach adaptive socialization skills, vocational skills, leisure time, and interpersonal skills, which include conversational skills, assertiveness training, conflict resolution, and problem solving. Now, BHIS, it is the policy of TSI to assure clients who are receiving BHIS services meet the admissions criteria. The consumers must have a valid DSM Access 1 diagnosis, recent persistent functional impairment caused by a mental illness, and it must meet one of the following: aggressive physical or verbal behavior that disrupts the setting which they occur, depressed mood or agitation related to a diagnosis of depression, recent behavior that pose a direct risk to self or others, isolation that results in persistent impairment in functioning, persistent and validated psychosis that results in persistent impairment of functioning, obsessive behaviors that result in mental illness that cause persistence in functioning, therapy or medication management services that be attempted previously or further function therapy or medication management services that have been attempted previously with further functional progress needed as identified by the measure tool. If they have not been attempted previously, there's a valid clinical reason outlined in the assessment. The consumers must have a valid DSM diagnosis that remains a principal diagnosis and must meet one of the following. There's a reasonable likelihood the benefit as a result of continued intervention based on the current or revised clinical treatment plan. The consumer and the family are making progress toward the goal and actively participating in the intervention. This is progress that will be required for further treatment to reach the measured level of stable functioning. The symptoms or behaviors required admissions continue without significant improvement, and the clinical treatment plan is formulated. New symptoms or implementing meeting admissions guidelines appear. Exclusions to BHIS is speech and occupational therapy, developing skills, music therapy, treatment of mental retardation, educational programming, services that do not interfere with school instruction, daycare, recreation, respite, group treatment in over 8 members, multiple siblings receiving treatment using family interventions as possible. BHIS skills. It is a policy of TSI to provide one of the skills outlined in Magellan when providing services. The procedure. TSI staff will follow the treatment plan. With it, we will teach one of the following skills while attempting to teach the learning style. We have conflict resolution, problem solving, social skills, interpersonal relationship skills, communication, executive shifting cognition, set of organization planning, separating thoughts and emotions, language processing, emotional regulation, and cognitive flexibility. Now, the service components of BHIS is that The procedure is an independently licensed clinician must oversee the services, treatment plan, and provide concurrent therapy as indicated. The professional may be licensed in an LISW, an LMFT, an LMHC, a licensed psychologist, physician's assistant, an ARNP with mental health certification, or a psychiatrist. A clinician must meet Magellan's credentialing standards in Iowa. A treatment plan will be developed for behavioral services, identifying the problem, action steps, strengths, and goals of time frames. If the clinician requesting BHIS is not the current therapist or medication management provider, a clinician must coordinate with the treatment plan with those providers. The identified clinician will coordinate care with professional providers for the medication management. The family is engaged and approves of services throughout the treatment process. The family must be present within 50% of the intervention. Siblings are involved in treatments simultaneously should have appropriate combination of shared family and individual interventions. A thoroughly documented treatment record. After discharge planning must be initiated at the time of admissions and accumulates in a comprehensive discharge plan. Appropriate other mental health and substance abuse services may be considered. An active treatment plan must focus on stabilizing or reversing the symptoms that are necessitates at admissions and developing skills to improve their overall functioning. Treatment plans will be updated and reflected in the consumer's file. Natural supports and community sources must be tapped into when at all possible. Identify and clinician will coordinate with the medical provider, and the coordination of the clinical treatment plan will be identified with the school staff as well. The last thing regarding patient-staff ratio for BHIS services is the policy of TSI staff and supervisors following the staffing plan regarding staff-patient caseload will meet per Magellan's requirements. The group must have 1 to 8 patients. Individuals must have 1 staff to family and individual client. Staff may not carry more than 15 clients without permission of the TSI president or vice president or designee. If at any time the staff caseload exceeds ratio, the staff will have written permission. The supervisor will monitor a caseload and timesheet on a bi-monthly basis. The staff will initially get verbal warning if cases will be reassigned if the staff is out of compliance. The staff ratio is exceeded again by the same staff, the same evaluation period, the staff will be reprimanded in writing and there will be an action plan. If the staff ratio exceeds the 3rd time within the same evaluation period, the staff will be disciplined and could lead up to termination or the discharge of employment from TSI.